Hi, I'm Dr. Gautam Zaveri. I'm a consultant spine surgeon in Mumbai, working at the Reliance Foundation Hospital, the Jaslok Hospital, and Zen Hospitals. I am also an honorary consulting surgeon at the Rajawadi Municipal Hospital. So I got involved with the Spine Foundation through Dr. Bhojraj. He invited when the camp was started at Dharampur in Gujarat. Dr. Bhojraj invited me to help out with that camp, and I was very glad to get that offer because it allowed me to contribute my skills and abilities to the treatment of poor patients in these tribal areas of Gujarat. I have been involved with these kind of camps, charitable camps, as well as doing regular surgeries, free surgeries for patients, both at the Rajawadi Hospital in Bombay, where I'm an honorary doctor, but also since my student days when I used to do polio corrective surgery camps in the rural areas of Maharashtra, and have ever since been involved in a variety of such uh, endeavors. So I specialize in almost all types of spinal pathologies, primarily in the management of spinal degenerative conditions like slip disc, sciatica, lumbar canal stenosis or pinched nerves, spondylolisthesis, spinal tuberculosis, spinal fractures, especially nowadays in the elderly population, what are called as osteoporotic vertebral fractures. And finally, I have a special interest in dealing with the management of spinal tumors or cancers. So I have been involved with spine since my training during my residency days from 1992 onwards. So it's almost 30 years. But subsequently, I did a fellowship in spine surgery in Canada and in England, which further improved my abilities in diagnosing and treating various spine pathologies. In the normal population, about 4 out of 5 human beings, that is 80% of human beings, will suffer from a spine related problem sometimes in their life. When they suffer from back or neck pain, they panic and they run from pillar to post in order to get some kind of treatment for this. And usually they end up being inadequately treated and continue to get chronic or persistent back pain. The message I would like to give people who are watching this video is that spine problem is usually not because of anything dangerous. And if treated properly in appropriate time, you will get better if you take good treatment. Do not let spine problems frighten you. That is the message I would like to give the audience. So, almost 90% of spinal conditions are treated non operatively. Less than 10% of patients with spinal problems require surgery. Surgery is recommended when the non operative treatment fails or when the patient comes to us with very severe pain or when the nerve does not function adequately, because of which the patient is developing weakness, numbness, tingling numbness in the legs or hands, or he's developing loss of urine control or stool control, what is called as incontinence. That is the typical indication for surgery. So, the most important thing that one can do in terms of treating patients with spinal problems and preventing further problems is regular exercise for the back. A lot of people think that tell me that they walk every day for half an hour. Walking is a great exercise for general health, but walking is not necessarily helpful for the back. For the back, you need to do back specific exercises, and yoga is a fantastic exercise in that sense. Along with that, a proper diet in order to, with proteins, calcium, and vitamin D, and care about the posture in terms of how to sit, how to stand, how to walk. All these are important things which can prevent or reduce the risk of developing back pain in the future. So, a message that I would like to give our audience at the end is that bed rest is bad for the back. Bed rest results in weakness of muscles, in stiffness of joints, It causes depression and loss of coordination of muscles. And besides that, there are other problems such as hypocalcemia, osteoporosis, urinary tract infections, chest infections. My message to patients with back pain is use your back or lose your back. Thank you.